Well, I would like to welcome everyone to the first segment of our 5-part webinar series. My name is Kathy, and I will be moderating today's session. We are so glad you all could join us today to get ready for record-breaking success in 2019. We are here to help you prepare for the end of this year so you can hit it hard next year. Before we get started, I would like to take a moment to review a few items. Due to the number of attendees, everyone is currently muted except for the panelists. At the bottom of your screen, you will see a Zoom meeting control panel. There you will find the chat feature, which allows you to chat with myself and our panelists. If you have any questions during the webinar, you can post them right here and we'll answer them as soon as we are able to. In addition, an important survey link will be posted at the end of the webinar in this area. We appreciate any feedback you can give us. Throughout the webinar today, you will be asked a few polling questions to get some input from you. The polling questions will pop up on your screen and you will have a few moments to answer. We will share the polling results with you when we are done. I am pleased to announce that on our call today is our Customer Care Manager, Katie Lawver, who will be leading today's session to help you assess what's going on with frame sales in your practice. While Evan, our COO and industry expert, will give you tips on creating routines for 2019 to make sure your frame boards don't get stagnant. We are so excited to help you learn how to boost your sales and prepare your frame boards for success in 2019. Now welcome Katie Lawver.
Thanks, Kathy, and welcome everyone. So today we're going to show you how to use Edge Pro to do a year-end review so that you can assess your frame board performance in order to set the stage for a successful 2019. We're going to take a look at turnover rate and learn why it's important. We'll dive into high margin frames and the importance of utilizing them for your vision plan patient. And we'll touch base on two major holes in your optical, your patient-owned frame numbers and your $0 frame sales. We'll be providing everyone with a worksheet via email after this webinar so that it's easy for you to calculate these numbers in your own practice. Creating a routine for yourself to look at these areas is critical to your practice health, and today you're going to learn why. So first, we're going to talk about frame turnover rate. So frame turnover rate is essentially the amount of times you sell through or turn over a frame line in your practice. So let's go ahead and do a little poll. How often do you assess frame turnover rate in your practice? Now, typically when I'm working with practices and I ask this question, pretty much across the board, everyone says never. And it's because they either don't have a plan in place or they have no idea where to get started with this. So let's take a couple seconds to get the results. And Kathy, do we have our results in yet?
I would like to get a couple more because we're at about 65%.
Okay, great. So yes, if you see the pop-up on your screen, just go ahead and make your choice.
All right, great. So it looks like we have about a third of our attendees never assess their frame board turnover, and then our next group do it about once a quarter.
Okay, great, great. So just as I was saying, the majority of people don't assess frame turnover rate, and this is crucial. This is one of the most important things that you can track within your practice. And the reason is because if you have frames that are on your board, they are taking up real estate and not paying their rent if you are not taking a deeper look at how they're performing. So what we recommend at GPN Technologies is that you have a 2 to 3 time turnover rate. And we have a worksheet that we're going to share with you that's going to help you to calculate out this number. So Evan, can you talk to us a little bit about why we need a 2 to 3 time turnover rate, why that's important?
Sure, Katie. Show the Edge for a couple minutes first as well.
Perfect. So what we're going to do is jump into the practice breakout dashboard, and this will allow you to see how you can assess frame turnover rate. So if you go to our Enhanced Edge Marks button and go down to Practice Breakout, You'll want to be sure that you are toggled onto the year-to-date date range since you're doing an end-of-year review. And you'll want to take a look at all plans. So this is the dashboard that you're going to utilize to actually complete the worksheet that we're going to provide you with. So what we're looking at here is all of your frame lines that are in your practice. So we pull this information from your practice management software from the inventory system. Underneath total, you're going to be able to see exactly how many times you've sold a frame from that line. And then next to it, you'll see the monetary value that that frame line has for you. Patient is going to be what the patient paid out of pocket. Okay, Evan, so what about that 2 to 3 time turnover?
Well, the way we've always thought of frame brands are they're similar to apartments, and the tenants in the apartments have to pay rent. What we've learned from doing forensic studies and looking at P&Ls and profitability is, on average, in order to keep our profit margin in a healthy place, each brand has to sell at a rate 2 to 3 times higher than the number assigned in inventory. So for our inline brands, such as on the bottom, we have the example of Michael Kors. Other inline brands are BB, Banana Republic, Kate Spade, Ray-Ban. All of your well-known brands are considered inline branded products. They should turn 2 to 3 times. Sometimes folks are in the penthouse, which are going to be their luxury products that usually sell for above $400. Those don't always have to turn 2 to 3 times. It's okay for them to turn at least 1 to 2 times. On the other hand, if you have frames for Medicaid or other low-end frames, we don't calculate turnover and have a number associated with that, because many times they could turn 15 times or 20 times, because if you have a selection of 40 or 50 in stock, you may end up selling 300 or 400 of those. So for this example, and starting to prepare for 2019, we want to go over how to use this worksheet and how to set the stage for next year. So in the example, we're looking at Michael Kors. The goal is a 2 to 3 time yearly turnover. One of the biggest misnomers about turnover is how often are we able to calculate turnover, and what if we do it every quarter versus every year? How does that work? So whenever we use the word turnover, and if you read any of the industry publications, it always means yearly turnover. So the hardest part, most typically, to calculate your yearly turnover is understanding the next column, which is C, assigned units in inventory. What that means is when the sales rep comes in and fills up your board, how many do you keep in stock when the board is filled? And if it's not the same number every time, then one thing I'd like you to write down for 2019 is to map out your optical and set a standard number of frames you're going to keep per brand for the entire year. We're going to evaluate it throughout the year, and when we bring in a new brand, we have to get rid of an old brand. But there's no way to properly merchandise, there's no way to properly train your team or yourselves. And there's no way to calculate frame turnover if we change the amount of inventory we have on hand for an individual brand throughout the year. So let's say that that's 30. The next column is how many units were sold in a quarter. You could also do this for the whole year at the end of the year, but let's do it for 1 quarter. So we sold 15 units this quarter. Remember, when we talk about turnover, we're talking about yearly turnover. So if we sold 15 in a quarter, and there are 4 quarters per year, that means we would have sold 60 units in a whole year. Once we have that number, we take our 60, divide it by the number of units assigned in inventory, and that is 2. The most important column on this whole spreadsheet is how do we take action, and what action should we take? So there are 3 possibilities: either hang on to it, pay attention to it, or that tenant's got to be evicted. So in this case, our goal was 2 to 3. We have a 2, so we will hang on to it. If we got below a 2, it does not mean to get rid of that brand immediately. It may mean one of 3 things. We have to re-merchandise it. Maybe we sold our best sellers in the first few weeks and haven't replenished the inventory. It may be in a part of the office that people aren't looking at as often. So we may want to move it to a new place in the office. We may want to train our staff around the story of a brand. So just because for 1 quarter we're below the 2 to 3 times ratio, that doesn't mean move it out. So as part of your 2019 plan, when you look at all your brands, use this worksheet to not only decide what to keep, what to watch, and what to remove, but use this worksheet to say, okay, we're going to re-merchandise this brand. We're going to move this brand into a new place. We're going to have the sales reps in to train us on the story of the brand. And in 2019, set an expectations with all your sales reps. The only way we're going to bring in a new brand is when we decide we're no longer keeping one of the brands we have. We had some questions come through, so feel free to ask questions while we go. The most common question is, where can we get this worksheet? So how does that work, Katie?
Yeah, so we are going to be sending this worksheet to each of you via email after the webinar. This will also be a document that will be added to our help center so that if you ever misplace it, you can go there and get it again. But we will be sending this out to everyone. We have your emails from your registration. Okay. All right, so Evan, based on your experience, how often would you suggest that practice owners are evaluating their frame turnover?
So it's important to look at frame turnover 4 times a year, each quarter. We don't want to wait till the end of 2019 and say, oh my God, I bought a new line in the beginning of the year and it only turned 1 time. Or, oh no, I've had this line for 15 years and it hasn't been working at all. So 4 times a year, just like this worksheet shows, is the optimum amount of time to look at frame turnover. One thing about the Edge, especially with frame board management, it's not necessary to look at the Edge for frame board management 5 times a week. So in this case, the routine should just be 4 times a year.
Okay, great. All right. So now let's talk a little bit about high margin frames and the importance of utilizing these for your vision plan patients. So let's do another poll. So once again, when you see the poll pop up, go ahead and submit your answer. So how many of you know what a high margin frame is, and how many of you actually carry these frames in your practice? So same as with frame turnover rate, most of the time when I'm working with practices and I ask them about high margin frames, they have no idea what a high margin frame is, and therefore they don't carry them in their practice. So for those of you who don't know what a high margin frame is, these are frames that you purchase at 70% off of the frame's data price. So you're paying minimal cost for a frame that can then be marked up based on the original frame's data wholesale cost. So this increases your profit margin, making it a high margin frame. So Kathy, are we still waiting on some people to answer?
No, I think we're good. So it looks like majority of people do know what a high margin frame line is, which is great. And we have about 75% of our panelists that do carry it in their practice.
Oh, wonderful. Okay, that's great. That's great. So for those of you who do not carry high margin frames in your practice, one of the services that we offer at GPN Technologies is that we actually publish a list during the spring, right after Vision Expo East. We publish a list of these high margin products to help practices find and select these so that you can put them into your optical. So be on the lookout for that next year. So high margin products can have a huge impact on your business. By having your vision plan patients choose frames from these lines, you're able to increase your profits. So once again, in our practice breakout dashboard, we can filter this by plan. So if we come up here, let's choose VSP, for example. This will allow us to see what frame lines our staff are going to for our vision plan patients. So if we turn on our true pricing, this will allow us to see what the patient paid out of pocket plus third-party collections. So Evan, can you tell us a little bit about what you've seen in practices that you've consulted with on what percentage of the frame boards should be dedicated to high margin frames and other ways to evaluate product markup?
Sure, Kathy. When your practice accepts vision care plans and they account for over 30% of exams in your office, let's say 30% to 75%, which is most practices, you should dedicate at least 30% of the frames you have available to high margin product. And I was very happy to hear that 3/4 of you have high margin products. Now we want to talk about how to evaluate them and how to use them. So the TJ Maxx effect, or comparative value, is the best way to start. So the TJ Maxx effect is you go shopping, you see a shirt that's $55 normally, but they have it available for $20. It's the same concept that we want to use of comparable value in our office. So when we send out a list of high margin frames during Vision Expo, we work with Marchon, Safilo, Clear Vision, and many of the frame companies to allow you to buy the same frames that you already have in your office that you already paid full price for. So if you're on a 12-week cycle, it's very possible that the frame you paid $100 for is now available for $20, the same frame. So that means you could continue to have the same frame markup on all of your new high margin frames. That doesn't mean you have to sell all the frames at full price, but it means your retail list price should be that full price. Many of the frames you can have included with VSP in this example. So why don't we talk about what's the profitability on a high margin frame versus the profitability on a full price frame that we would sell with VSP. So if we go and buy a frame for $30 that has a $30 wholesale cost, and a patient with VSP wants to buy it, most typically that frame will have to be sold for $0 out of pocket. Our reimbursement from VSP will be very similar to the wholesale frame allowance of $30 plus a dispensing fee. So the $30 will cover the $30 cost of goods, and the money we make is the dispensing fee. Conversely, with high margin, we could buy a frame that has a $60 frame fax for $20. If we buy it for $20, the patient still pays $0. That they feel that they got a more valuable frame included in their plan. So it's a win for you, it's a win for VSP, and it's a win for the patient. And your reimbursement, instead of being $30, your reimbursement is $60 because that's the wholesale cost. And then you get the dispensing fee as well. So your profit is now your dispensing fee plus the $60 you get from VSP minus the $20 wholesale cost. So imagine making $40 more on every frame. One example we see here is the first one, affordable designs. We sold 39 of them in this practice. We didn't get much money from the patients out of pocket. Some of them maybe were charged $20 or $25. But when we got all the reimbursements, it comes out to be $2,600. So if each of those frames were even $10 each, and I think they're $5 each, we only spent $390 on them. So look at the profitability, even when patients spend $0 out of pocket. So one thing to look at quarterly as well is hit on the total button, please. You could sort by what frames are being sold most often and find out, are they inline product that patients are paying full price for? And most of these are, but there are two that stick out. One is affordable designs. The patients paid only $282. So then say to yourself, is this a high margin frame? Hopefully the answer is yes, and then you're in good shape. If we keep looking down, 8 to 80 is also a very low one. Is it a high margin frame? Yes, we're in good shape. And Marsh on NYC, did we buy that on high margin? Yes, we're in good shape. What this allows you to do is not only rely on the great optical team you have, but it has a system in place that allows you to generate profit, not only revenue, on each sale.
Hi, Evan. This is Kathy. We have a question that came in. Could you please explain the difference between true pricing and patient pricing?
Sure. So why don't we start by shutting all those off, Kathy, and turning on I can't say it. Oh boy. List price. So list price is the full price. If everyone came into your office, what is the full retail value of the frames being sold? So no discounts, no matter what. The second column is patient pricing. This is the most important one. This is the one that's used when we calculate what's your average frame sale, and throughout all of the Edge, we use this second column by default, and that is how much is the patient responsible to pay. So whether it's a self-pay and they got 20% off, or if it's a VSP or IMED patient and they had to pay whatever they're responsible for, this is ultimately what you, the opticians, have control over. How much the patient, what frames are you showing, and what will the patient pay? And then the third column is true pricing. that takes the amount the patient pays and combines it with the amount you got reimbursed from the insurance. Now, the true pricing is only available, or it only works for those practices who are line item posting insurance payments in their practice management system. From our most recent studies, we find that about half of practices are line item posting. And what line item posting means is if you receive a $5,000 check from VSP, line item posting means you go into your system, you find John Smith, and you say $30 was for the frame, $20 was for the exam, $20 was for the ophthalmic lens. Then you go to the next patient and you line item post. For those of you who line item post, true pricing is available, and it will show you what the end result is that happened. But as I said, it's only available for half the people who are line item posting. So the most important one that you want to look at is what is the patient responsible for.
Great, thanks, Evan. Okay, so now that we've kind of gone through our practice breakout dashboard, let's talk a little bit more about the two major holes in the bucket in your optical: your patient-owned frame numbers and your $0 frame sales. To dive into these numbers, we're going to go into our price point matrix dashboard. So up here under our enhanced edge marks button, we just scroll down to price point matrix. So Kathy, let's go ahead and do another poll. How often do you look at your patient-owned frame numbers, and how often do you assess your $0 frame numbers within your practice? So some people have a general idea of how often patients are using their own frame to put lenses into, but most practices have no idea how they're doing with their $0 frame sales. And for those of you that don't know what a $0 frame is, this is a frame that a patient uses only what their benefit entitles them to, so therefore they're spending $0 out of pocket. Okay, Kathy, so do we have some results?
We have some results. I want to give it a few more seconds for people to respond.
Okay. And same on this dashboard, just like our practice breakout, you'll want to be sure that you're toggled on year to date so that you can do your end of year review.
All right, Katie, so we have some great results here. How often do our attendees look at their patient-owned frame numbers? About 30% said once a month. Our next highest number was 20% said they never do. And then on our second question, how often do you look at $0 frame numbers? About 25% of our attendees never look at their $0 frame numbers. And then we have about 21% do it once a month.
Okay, great, great. So kind of all over there. So, okay, same as with assessing our frame turnover rate, it's really, really important to take a look at these two numbers, because if we're not looking at it regularly, we can be missing out on a lot of revenue. So when we take a look at the patient-owned frame numbers in this dashboard, we want to look at the percentage of patients that are using their own frames. So once again, at GPN Technologies, we recommend that this percentage is 15% or less. So in this practice, it's saying that 24% of patients year to date right now are utilizing their own frame. So they're a little higher than that 15%. So 24% of patients actually equates to 708 people. So when we have an average frame sale price of $128, that's a lot of revenue we're missing out on. And we actually calculate that out for you down here. So 708 people multiplied by that average frame sale price equals $90,000. So this practice has missed out on $90,000 just by patients putting lenses into their own frames. So one reason that we find patients don't purchase a new frame is because they don't want to spend the money, or they have a fear of what will happen to that new frame, you know, once they get it. So Evan, can you give us some strategies on how to reduce patient-owned frame numbers in the practice, and also talk to us a little bit about a WOW guarantee?
Sure. The think about sitting in your optical and you're showing a patient a frame and they're hesitating whether to get the frame or not. You've already talked about how much it is. It's $200 for the frame and they're not sure. Think about what is the go-to sentence you use to overcome the objection. And for most practices, the go-to sentence is, let me see if I could do a little. Well, actually, for no practices do you say it like that. That's how I talk. But usually it's a discount. And what we find is your discounts only work as well as the discounts are only minimally effective. So in this case, we got down to 24% of people are using their own frame. And as Katie said, our goal is 15%. So what other strategies are available? When people say, I'm not sure, I think I want to use my own frame, or the new frames are too expensive, the first thing out of your mouth should talk about your warranty. And what GPN has used is the WOW guarantee. The first time we used this in a high-end practice, the practice manager and the opticians were nervous about it. They thought, oh no, if we start taking back frames when the dog chews them, when they wake up and they just found them smashed on their night table, even though they put it in the case and never heard it, we're going to be losing so much money. And that's not the case. We got a phone call from a high-end practice in the first day they used it, when they were having a conversation about selling a frame for $1,000. And the same thing happened. Oh no, you know, I'm not sure, I may want to use my own frame, but I like this frame. So now the first sentence is, well, did you know we have a WOW guarantee? What's that? Well, the WOW guarantee is so you have peace of mind, and it protects your investment if anything happens to your frames for a whole year. Even if your dog chews them, even if you step on them, we will replace your frames or lenses, or both, with a copayment of $25. Everybody's used to the word copayment with their vision care plans or their medical plans, so they don't think of it as a fee. But even if they think of it as a fee, if you're replacing a $200 or $300 or $1,000 pair of glasses for a copayment of $25, we have found that the marketing that comes off the WOW guarantee is a huge boost for the practice, but more importantly, to the numbers you're assessing to begin with. If we go back to the edge, how many patients are using their own frame? If you start having a conversation around having peace of mind if you buy a new frame, your frame and lens is covered under the warranty, versus if you use your frame that's 4 years old, that frame may not be available anymore, and then we may have to replace your frame and lenses. When practices start having conversations about that, we notice it in this practice, we improved by over 4% this year over last year.
All right, great. So now if we scroll down on this dashboard a little bit more, here we can take a look at our $0 frame sales. So this is showing us, very similarly to our patient-owned frames, the total number of people who have spent $0 on a frame. So meaning that they've only used what their benefit covers. And once again, if we have an average frame sale price of $128, this is a huge opportunity to increase revenue. So Evan, with this, what strategies can practices utilize to push patients towards those high-end or high-margin frames? And can you also talk just a little bit about pricing your frame lines?
When we look at this chart, the first thing I see is that on the left-hand side, the line for $0 sales is much bigger than all the other lines. Does everybody see that? And all the other price points are pretty consistent, but it goes down slowly as you reach $250. So when you're evaluating your frame brands that you want to carry in 2019 and the ones you want to get rid of in 2019, the first one is make sure that all the brands that you do have that you're selling for $0 are indeed high margin products. And if you look at this and you have no sales or very few sales of $400 or $300 or even $200, the question to ask yourself is, how many frames do I have available for sale in that price range? You may say, Evan, well, half my frames have a retail price of $200 to $250, but that's not really what your sales are going to be, because if you have a policy that you give 20% off or any percent off for self-pay, or if you accept any of the vision care plans for a $200 frame that you have listed at $200, the patient may only pay $50 out of pocket. So if you want to sell frames for more money and have a higher average frame price and reduce your $0 frames, then you have to increase your selection in the $300 to $400 range by doing one of two things, either increasing your frame markup, and we're not going to go into specifics on frame markup unless there are any specific questions, or to bring in frames that you could sell for more money. We also have a worksheet to look at this. So the second page in the worksheet we're going to hand out allows you to see how many frames do we have available in each of these price points. We got a really good question. If we switch back, the question is, which price are these charts based off of? And the default value is, this is what the patient is paying out of pocket. And that's why when we're done with the managed care plans, many patients are paying $0. But in order to fill out that worksheet and in order to look at how much did the frames cost that were available for sale, why don't we go up top and switch this to list pricing. So on the right-hand side, you could pick your list, patient, or true. And when we scroll back down, we could see that the chart changes a lot. So now we could see in this practice that most of the frames are between $250 and $400 if you combine them. And we have a lot of frames in the $150 to $199 column. Any frames that have a starting price of $0 means they were entered incorrectly. It means that there was no value in the first place. So even if this is a Davis Vision frame or a Medicaid frame, all frames have value. So there should never be frames with a list price of $0. So if you have it, write down for 2019 to train our teams that all frames have value and nothing should have a list price of $0. When you look at this chart, if you go back to the worksheet, Katie, you want to fill out the worksheet on where you stand right now. And if you're trying to sell frames for more money, the thing about if you have a selection of mainly frames that are going to cost $0 out of pocket or $50 out of pocket, and you only have 20% of your frames that'll cost $100 or $200 or $300 out of pocket, why would they choose those more expensive frames? There's not a big enough selection available to make people want to go shopping, make people want to fall in love with a frame and buy one. So it's really important to not only look at what frame brands you have, but also use this sheet every quarter to understand what the price points are that you have in inventory.
Awesome. Great. Thanks, Evan. Okay, so I know that we've had quite a few chats come through, and I just want you all to know that we are going to answer your chat questions. If your chat question hasn't been answered yet, we will get back to you, so please be patient with us. I hope that you guys have really enjoyed viewing these dashboards today and that you now have the tools that you need to get some routines down for 2019. We hope that you will join us next week because we're going to be taking a look at staff performance so you can really see how your staff directly affect these numbers and learn tips on how to train your staff to have the right conversation with patients. So please stay with us just for a few more minutes because Kathy has some information to give you on how to reach out to us if you do have further questions.
Katie, I saw a great question. Hit the opportunities button. For patient-owned frame and $0 frame, you could also get a high-level overview that we'll go over in a future session of your patient-owned frame opportunity and your $0 frame opportunity. So for this practice, which we all saw they were at 24%, if they hit their goal of 19%, they can make an extra $18,000. It's not necessarily realistic to think you're going to go all the way down to 0% in one quarter or in 1 year. So the edge comes up with realistic set of goals, in this case 5% improvement needed, and then it shows you what your opportunity is, $18,000. The same thing for $0 frames. If they're at 39%, they're not going to go all the way to $0, even though it is worth over $100,000 if they did. Again, it's a small improvement of 5%. So this is a great page to glance at every month. One of the biggest mistakes practices make going into the beginning of the year is they try to do too much at once. So there's no reason to work on $0 frames and frame board management and patient-owned frames and anti-reflective and increasing all your exams all at the same time. Just choose one thing and work on it for 90 days. And then measure your results. Practices that take one bite out of the elephant at a time are much more successful over a 5-year period than those who just continue to cyclically try 20 things and fail at 20 things and try 20 things and fail at 20 things. So thanks, Katie, for showing the opportunities page. We could go back to the other pages we were talking about.
Okay, awesome. So Kathy, I'll turn it over to you.
Thank you so much, Katie. Evan, real quick, I do have a question that came in that I think a lot of our panelists would like to know. What do you recommend as a possible markup, or what have you seen as a possible markup in the practices you have helped? What is recommended?
Markup is not a straight formula anymore automatically. So if you're using a 2 times markup or a 3 times markup and it's straight across the board and you haven't looked into any other options, that's the old way of doing it. What we have to understand to get the markup in your practice is something called fair market value. And fair market value comes from any industry, whether it's clothes or cars or eyeglasses. It's what are patients willing to pay, or what are consumers willing to pay for that product. So if there are frames available online and everyone knows you could get them for $89, you may not be able to do a 3 times markup on those frames. While if you carry frames in your office that are not at your competition and not available online, you may be able to have a 4 times markup. So starting at a baseline, a 3 to 3 1/4 baseline rounded up to a 9 is a good place to start as a rule of thumb. But then it's really about understanding what brands you carry and understanding whether they're available at your competition, whether they're available out online, and what is the patient out of pocket really going to be based on the plans you carry in your office. We did a study in one practice on Flex-On frames, and Flex-On frames were selling at, they were their top seller, and we thought they were underpriced for the market. So we said, oh, let's raise the price $20. And when we raised the price $20, you know what happened? They were still the top sellers. So we ended up making a $20 more net profit per frame, which over the year adds up significantly. So there's no one rule of thumb. The right pricing strategy is called fair market value. It's okay to start with a rule of thumb, but you're not going to mark up a frame that costs you $200 the same as you'll mark up a frame that costs you $5. So I hope that helped.
Yes, it did. Thank you so much. I would like to, again, thank everyone for attending the webinar. At this time, I am going to put in a survey in the chat window for everyone to see. So please take a few minutes to look at this, to fill out this survey. We would greatly appreciate it. Also, if there are any questions that you do have after this webinar, I did display our email address. So please email us at customercare@gatewaypn.com. And then please, we look forward to seeing you everyone next week, which is next Tuesday at 1 p.m. Eastern, for our second segment, Dramatically Improve Your Staff's Performance and Effectiveness. We thank you again, and have a great, wonderful week. And I will also be on here to answer any follow-up questions that you guys may have.
Have an awesome 2019, guys. Use the edge, find the answers.
Thank you.
Thanks for joining.